FM in Grand Cayman and 93.9 FM in Kimmenbrack and Little Cayman.
Silver wings shining in the sunlight.
Radio Cayman.
This is For the Health of It with Tara Bush.
Brought to you by the Health Services Authority. Caring people, quality service. Visit hsa.ky.
For the Health of It with Tara Bush.
Brought to you by Healthcare Pharmacy, where they care about your health. 2 locations, Governor Square and Grand Harbor. Refill and transfer prescriptions online. Call 947-8900 or visit healthcarepharmacy.ky. Also brought to you by Cayman Medical Center, Cayman's most awarded private medical clinic.
And UHealth, International University of Miami.
World-class healthcare in the heart of Miami.
The Light Room, your holistic sanctuary for physical and mental restoration, repair, and rejuvenation. The power that made the body heals the body. 38 Pasadora Place, Georgetown. Find us online at www.thelightroom.ky or call 938-HEAL.
For the Health of It with Tara Bush.
Attention HR managers and business leaders. Want to boost productivity, reduce absenteeism, and show your team that their well-being matters? The Lightroom now offers custom corporate memberships designed to enhance energy and mental clarity, reduce stress, and improve overall health, creating a healthier, more focused workforce. Invest in your team's well-being, because a thriving team leads to a thriving business. Visit thelightroom.ky to learn more. It's a new era in wellness.
There's nothing more important than your health, and seeking expert healthcare with physicians you can trust is what you deserve. UHealth, the University of Miami Health System, offers peace of mind to you and your family with a first-class experience. Our patient coordinators assist with everything you need before, during, and after your stay with us. As South Florida's only academic-based health system, UHealth offers cutting-edge treatment, compassionate care, and life-changing results just a flight away. Learn more at umiamihealth.org/international.
When I first started going to Healthcare Pharmacy, it was because it was convenient. But over the years, I continued to shop there because I trusted them. One day I was picking up my prescription, and the pharmacist noticed an over-the-counter medication in my basket. She said, "I hope that's not yours. It will interact with your prescription." And I thought, wow, thank you. Trust is so important when it comes to your health. Healthcare Pharmacy, with 2 locations, Grand Harbor and Governor Square, where they care about my health.
Hello and welcome to For the Health of It. I'll be interviewing Miss Dorothy Davis and Mr. Philip Scott. We will be talking, this is part 2 of their interview, and we will be continuing about Mr. Philip's journey on cancer. Hello and welcome to For the Health of It.
Hello.
Hello, good evening.
So, Mr. Philip and Miss Dorothy, I'll ask you, Mr. Philip, if you could please just recap for the audience about your cancer.
Yeah, the first cancer I had was melanoma of the eye. That was in 2011. Then I came up, I had an operation for that. The next one was prostate cancer. That was in 2020. And then it was during the operation of that they saw or found that there were these nodules that needed looking into, and when they looked at them, they found that there was mesothelioma. So those were the three cancers that I had.
So that last one was a very complicated cancer.
Right.
It's usually found in the lungs, right?
Yeah. And
it's not even considered a cancer. It's more of a weird thing, but it's associated with asbestos.
Right, yeah.
And it's not pleasant.
Yeah. I think the majority of the cases are mesothelioma in the lungs, but they do have cases of where they have them within the
yours is a
the
peritoneal
area.
Yeah.
And you had to get some sort of, was it a hot pack?
Yeah,
It's
the high
called
pack. High pack.
HIPEC
Yeah.
surgery.
You
Which
want
is-
to explain that, and then we can get into the rest.
Yeah, high pack surgery. They said it was basically that they go in, they remove the nodules that they can find, and then they give you your insides, the peritoneal area. They give you a hot bath for about an hour in this chemical liquid. They bath the whole area, and that is supposed to kill off any remnants that they may have missed. And then after that, basically, they withdraw, they remove the liquid, and then you're okay.
But the hot bath is like a chemo.
Yeah, it's a chemo.
therapy,
That's right,
like
yeah.
a chemo.
So you're laying on an operating table. They've heated the chemo to 100 and something degrees. Your stomach, I'm painting the picture,
Yeah.
because this is not a little surgery. And, they pour this liquid in there, soak you with these chemicals for an hour.
Yeah.
And then after that, you had some complications?
Well, they had to remove, during the surgery, they removed a lot of organs because you had your spleen was removed, some of your liver, some of your kidney, some of the bladder, some of your intestine was removed, gallbladder was removed. What everything that you could think of.
Yeah, I don't think they touched my kidneys, though.
No, I mean, sorry, not your
Yeah.
kidneys. Sorry, not the kidneys. I think it was the bladder.
Yeah,
your
the-
gallbladder.
Yeah,
Your
and my
gallbladder.
bladder. And my
your
bladder.
and your bladder. Your,
Part of
wasn't
my
it your
bladder.
appendix or was the appendix removed?
No.
But it was lots, like everything you could think of. There was a bit of removed. Like for instance, your intestines.
Yeah, they chopped off
some of that.
half of that or whatever.
Was removed.
Yeah.
And it was like it was like between 14, I could be 14 to 15 hours, but I guess by the time you're
Mhm.
out of, into recovery and so forth, it's like more than 16 hours.
And then
surgery.
after that, you had some complications for a while?
Yeah,
Yeah.
because after that you had, you were in critical care because the critical care or ICU has tiers. So
Mhm.
you're very critical after surgery or whatever the ICU. Then
Right.
they have what they call a step down unit of the ICU, where you're still monitored, but like you're not monitored by one nurse 24 hours. So you're now maybe monitored with a nurse with different patients.
Yeah.
And you were still in a separate room, yeah. And you have a nurse and a nurse assistant. And it was during that time, I think you were in that for a few weeks.
Yeah.
You then had developed some kind of
Pneumonia or
breathing,
something.
yeah, breathing issue,
Yeah.
which then became critical.
And I still do not understand how you didn't give up by the sounds of things. I mean, you were nearly comatose for a period of time.
Almost a month.
Yeah, you had to advocate like hell for him to make sure that he didn't go in. He had to go to a specific facility. You didn't want him to go to
like a nurse. Like it's almost like it's, to me, it's a nursing home. It's a nursing home.
That was a rehab place that I was sent to.
No, the rehab place is where you went to.
Oh.
However, because he was not what they require, or I mean, what they see in the hospital as, you're not getting any better. You've been here a long time. We've taken you off the ventilator. You've had the trach, and you're not being able to eat. You're not eating, or all of those things. Like, it's almost like you have given up and you're still in hospital. Bear in mind that time they were worried about him becoming more ill, because the longer you stay in hospital, you pick up all kind of diseases and infections and so forth. So they wanted him out. And however, the center that I went to inspect, what they call the Elin Rehab Center, is it's like the Ritz-Carltons of rehab centers in Florida. And their motto is, once you come into our facility, within 14 days, we rehab. You're on your way to better living. I mean, better than what you came in. However, they do not take patients with a feeding tube. So that was the reason why they wanted Philip then to go into this kind of like a nursing home where he had a feeding tube. He would still be kind of cared, but he would not have the medical care daily and like 24-hour medical care that he was having in the hospital. They had a doctor that came once a week, maybe twice a week. You would have maybe physiotherapy, and that would be it. For him, looking at him and me seeing him and knowing that would have been end of life for him. I would have to just sit back in it, and I wasn't prepared for that. He'd been through too much, whether they saw the fight. Philip is not a fighter anyway.
That is what you think.
I mean, that's what I think.
I love that.
I thought he was not a fighter. He doesn't appear to be a fighter for all the 20-something years that I've known him. He doesn't appear to be a fighter. Maybe that was his younger days. However, he was there, not real. I mean, he survived, but I personally didn't see the fight. And I think his medical team didn't see that fight to get better and get out of here. Right. However, when he did go into the rehab center, now that was a different story because they were working with him. I know poor him, he couldn't, because he had to learn to walk, talk, do everything for himself all over. And when they would come in the morning to say, it's time for your physio, Mr. Scott, they would wait for breakfast is over, like 7:30. And I felt sorry for him because they're not playing around. They're getting you up. You're standing up. They're holding him up with a belt because now he can't stand, and doing all of these things for you. And he was, okay, the 14 days, because he was so far gone, the 14 days did not. But they had to go. He was there like 6 weeks. Yeah, 6 weeks.
So, Mr. Philip,
how,
when learning how to talk and walk again, what made you come back?
Well, first of all, talking about not being a fighter, for me, at the time, it was like the main thought that I was thinking was, how long am I going to be in here?
Right.
That was what was in my head, right? How long am I going to be in here? Because I have to get back. I have to get back, and I have to get back to work, right?
This was with the Ministry of Education.
Ministry of Education. That was what I was thinking about, and that was always at the back of my mind.
Oh yeah.
So
that's all he thinks about. All he thought about was work back then. I forgot that.
So it was like just trying to get through the day, each day by day sort of situation.
How hard was it?
Well, for me, it was just surviving that period, passing the time, thinking about certain things, but it was basically just passing the time, really. Trying to watch a couple of programs. Well, you're watching the TV, but you're not really taking anything in. So yeah, it was pretty boring in that sort of sense,
How did this experience change how you see your life and your priorities or your health?
Oh, my priorities.
Is work that important now?
Well, now that I've retired, so it's kind of like, actually it's been a bit difficult to make the transition,
yes,
right? Because I've always been work focused, right? So suddenly finding that I don't have work to go to, I don't have work to capture my imagination, I don't have things to research, I don't have things, that has been difficult. So yeah, that sort of priority is a little bit difficult. But having said that, like say my spiritual thinking, people think, you hear people talk about God and how they relate to God, or how they relate to going to church, how they, all that sort of stuff. What I've found is that I'm spending a lot more time thinking about what did Jesus say? What is it? The kingdom of heaven is within you. Yeah, rather than outside where you've got to go to. Yeah, it's within you. So if you look inside, you will find things. And for me, that has been something that I spend a lot of time dealing with and trying to grow in that sort of area.
Nice. Miss Dorothy, have you taken time to slow down?
No.
Well,
no. Mine was tired and more tired and more tired. But for me, being tired, I couldn't slow down, because then if I slowed down, I would think too much about what is going to happen, because I don't want to think about what is coming, if you know what I mean. Because I was sat down and spoken to with the doctors about things to come, how they would look or what would happen. I remember when he had the eye surgery, the doctor spoke to me about all the dreary. I did the research then about all the dreary things that could happen, like he could lose an eye. What you going to do when you had the surgery? Because that was another weird surgery that he had went through, all these weird procedures with taking out the eye, putting in radiation plaques and all of these things. And then, they said the person is radioactive. You can't touch him. You can't do this thing. You can't be in the room with them. And so that was that. You got over that hurdle. Then you think your life is going. Then you have prostate cancer. You got the prostate cancer again. Was like, oh my God, this is what could happen. Then you got over that, and then you're on to mesothelioma, and you say, what the heck is mesothelioma in the lining of the stomach? And here you are, and then you know the outcome, because usually people with that type of cancer only live like about a year after. Philip is now going on to your 4th year after the surgery.
It's 4 years now.
4 years after his surgery. He is an exception to the rule, right? So that is some of the things that, and when you mention about I find that is what keeps me, what do we say, like when if I jump off of this treadmill that I'm on now, I might
I think it's a way of keeping her
it's
mind.
like coping, it's like my coping mechanism, sort of. If that ever, like for the week that I was ill for myself, that was like, oh my gosh, that was like I'm going crazy. So I spent my time actually on the computer, because I know I couldn't be out of the house or whatever, doing things for other part of my life, which is the association. So I know I'm not taking the best care of myself, because it has showed up in manifesting some health issues. So I don't know. For me, it's...
Yeah.
What would you want other caregivers to know, especially those that are in the thick of things right now?
Well, one of the things that we always preach is you have to take care of yourself. You must take care of yourself, because if I'm sick, then I can't be there for him, right? When I was sick, this is my sick husband who had to help take care of me just the past week. So, and I felt so bad for him, the hip pains and the back pains, that he have to come and do all this to help me. But it's like taking care of yourself. Finding that even a time to sit under a tree, learn to do he taught me how to do the breathing exercises, which help. It really do help to do those breathing exercises. And that's one thing I would tell anyone, practice that. It doesn't take anything. It's not $1, but get somewhere quiet, peaceful, and just learn to breathe. Because it's even helped in lowering my blood pressure. When I go to the hospital, blood pressure is high, and it's just calm. It's a common thing. I am a very high-strung person. I'm the kind of like blah, 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 whereas Philip is the opposite to me. He's very calm and peaceful. So it takes a while for me to come back to to find that balance and calm.
Do you all want to do the breathing exercises so that you can teach them to our audience?
Yeah, you walk you through it. Okay, he's told me to breathe in for a count of, four. I do for 4.
Okay.
Hold for a count of 4. Breathe out for a count of 4, and then you count to 4, and then you breathe in again. And I do that for probably 10 minutes or so. I do that for a couple of minutes, and it's not difficult. I might not do it be perfect way to do it, but it helps me. That's my way of doing it.
Yeah,
Was that right?
That's the box breathing.
Yeah.
We call it box.
Yeah.
It's very grounding.
Yeah.
Yeah, and it resets your parasympathetic nervous system to rest.
Oh, okay.
Your you're in fight or flight when you're breathing in your chest, and this one resets you to rest and digest,
Right.
which is where we should be.
Yeah.
But in our modern, ever-changing world, we're mostly in fight or flight.
Yeah. But one of another thing I wanted to say during all of this journey, I had to retire because I couldn't be in Miami with him and do the job I had, because my job was manager of a department. Mm-hmm. And it was very difficult to manage people who are working from home and all of this. And I was very stressed. And I remember when you had the prostate surgeries, he would see me, I would have to attend to him. Then after attending to him with all the different things that he had to do, I would then have to go back to work remotely on the thing. And I found one day, I felt like I crashed. I couldn't get out of bed. I was very emotional without him seeing it. I mean, and I said, I don't know whether financially I can retire. However, I just need to do something. But we came back home, and I went back to work. Then he got the news, and I had to make a decision. I can't do both things. If I am going to be there for him, I can't do the job. And one of the things is having empathetic employers, which I find it's lacking in Cayman. Not every when you hear somebody is sick and you are going through, you don't know how that affects everyone. I mean, Philip, it's just he and I. Let's say he and I, because Philip doesn't have a sister or brother or anything, which makes it difficult. And it's just he and I. Mm-hmm. And especially during COVID time, people were not able to come around. So we needed to be there for each other.
Yeah.
And so I made a decision of going, and then many times I felt angry that I had to do that because I wanted to work. Mm-hmm. And I felt like this blame game, like a why
mm-hmm.
why this happened to me. And then I have to say to myself, well, it happened to me. It could have been the flip side. It could have happened. He could have been the one on the other side.
So what made you move to acceptance?
I went to therapy. I went to different. That's another thing for me. I don't know what therapy is supposed to be like, but if I don't feel anything, I'm not going back. And I told them I wasn't going. So I went to several different people. Okay. And I found one that actually spoke to my spirit. It was like, this woman has been watching me somewhere in existence, and I felt like she understood. And one of the things that she said to me, I was holding in a lot of animosity, mm-hmm. and I needed to let go of it. Yeah. I needed to stop trying a way letting go, and I didn't even know. You don't even know, but the things that I was saying, I guess, mm-hmm. decided. So that was my way of dealing with it. I still have a long way to go, I think. I mean, with a lot of things, it's not about the animosity, but it's like, God forbid if what's going to happen. Like, I have this fear of waking up in the morning and he's not breathing. So I don't like sleep. I mean, that's the first time I don't like sleeping in the same room Even though I can't sleep because I like cold and he likes hot, and that doesn't. So, but that was my fear, and so I would always look in the night, like, is he breathing? Or I get up in the night and check, and all of those things are like I don't sleep well at night.
Yeah.
If I'm thinking, okay, what if he calls me and I don't hear, and it's an emergency? Because not only is it about the cancer, but he also has these things called silent seizures. What happens if I am not aware that something is happening?
Right. And Mr. Philip, how are you looking at this experience? I mean, even though you didn't fight back like the spirit me and Miss Dorothy would have, but you were a quiet warrior because you came back.
Yep.
Do you have gratitude for the life you have now?
I do. I might not express it as openly, but I do think about it a lot, and yeah, I feel very gratified, or gratitude towards being alive, actually.
Yeah. And Miss Dorothy, I mean, you were saying, what would you tell somebody who is going to go through this? Because I've interviewed 3 people, and each one of you all have had multiple cancers that have kept you in the hospitals. The person with cancer in the hospital for months at a time.
Right.
So this isn't. I thought it was unique. I mean, it is unique that that it's that long. But what do you say to people who are going through it? I mean, do you tell them to fight for their loved one like hell? Do you say pray? All of it?
I say all of it. I say pray. I said fight. You have to advocate. I mean, not because your loved one is in the hospital that everything's going to be perfect. You have some nurses that just they care, but they don't show the kind of care that you expect to show the care. So you have to advocate for the best care for your loved ones. You be there, be in their face, if you have, that is the word, be in their face. And you look at, because I would look at things, for example, was his teeth brushed today? And because he had a problem swallowing and things like that, the food would be in the side of his mouth because he's not swallowing the food. And I would find the food and I would open his mouth to then, I say, can you bring me a brush, please? Just to get the food out of his mouth. Little things like that, that I shouldn't have to find that. That thing, if a syringe drop, I expect that syringe to be not there the next day that I return. So, was I stickler for mine? Like I was all the time. I sound like a complaining person, but bringing this to their attention, this should not be there, that should be there, they should have done this, they should have done that. So it's advocating for good care. You want a clean environment and so forth. Even the best of hospitals, the doctors may be the best, but doesn't mean the environment is going to be the best. So that is one thing. I mean, if a person can stay, the sad part about it is when a loved one cannot stay with their person that is hospitalized. That must be so bad, because you don't know the care. When you walk away from that facility, you don't know the care that individual is going to get. I mean, you trust them to be, as I say, the doctors might be the best, but is the nurse going to be like a nurse for Philip said when I got there, she said, "Oh, you're here. Your husband was asking for you." And I told him, "I don't know what time she's coming." I just thought it was so mean. And I mean, I might be mean too. I just said, I don't want her. I don't want her back.
Yeah.
I told the nurse practitioner, I do not want her back. And she asked me why. I said, because of that. If I am not here, how would I know? Because right then, to be comforting, I mean, she should have been comforting. This is the day after the surgery. She should have been more empathetic and say, well, Mr. Scott, I'm not sure, but I'm sure she's soon going to be here.
Right.
But when she said, oh, I don't know. and then just walked away. I told him I don't know what time she's coming. So I mean, I complained a lot, and I mean, now I look back, I'm hoping they don't think I'm a horrible person. When I walked away from that hospital at the time, I said, oh my God, I hope that I'm not a patient here, because what's going to happen to me?
We have a minute left. How would you like to end this interview?
Well, for me, it's about having your spiritual side together, having faith in what you think you can still do in life, and what where you can go with that. Basically, and keep going, just keep going, basically.
Even when you think you can't. It sounded like that. Like it wasn't getting through the day, it was getting through moments at a time. If I get through this physiotherapy, if I get through this meal. Rather than a whole chunk of day. And Miss Dorothy?
I don't even remember the question now. I was thinking, there were so many things in my mind right then. I was just thinking of us in the hospital celebrating the little things, like when he stood up by himself, of just celebrating those little things. That I remember I did the video and sent to my children. Oh, he took 2 steps today. or when they asked him to repeat a sentence and things. So it's remembering those things. I mean, we have, I think for us now, I think for you and I, we just, we need to celebrate more. I don't know if celebrate the moments more. Because I think right now we're so caught up with the medical side, or with going to doctor, doing doctor appointment right after the other, all of those things, but doing the things that make us happy, the fun things that we were doing before, because all of our plans were cut short, but they were just cancelled because what the things that we wanted to do prior to this. It's find a way to get that oomph back.
Well, you'll get it back. I think you have it there.
Thank you.
Thank you so much for listening to For the Health of It. You've been listening to me interview Miss Dorothy Davis and Mr. Philip Scott. You've been on For the Health of It. We are moving you to the life you want.
Attention HR managers and business leaders. Want to boost productivity, reduce absenteeism, and show your team that their well-being matters? The Lightroom now offers custom corporate memberships designed to enhance energy and mental clarity, reduce stress, and improve overall health, creating a healthier, more focused workforce. Invest in your team's well-being, because a thriving team leads to a thriving business. Visit thelightroom.ky to learn more. It's a new era in wellness.
If you or your loved one is facing cancer, only Sylvester will stand firmly by your side at every step, from diagnosis through survivorship, providing you and your family peace of mind and assisting with everything you need before, during, and after your stay with us. Sylvester Comprehensive Cancer Center is South Florida's only NCI-designated cancer center and specializes in treating the most complex cancer cases. Your first-class cancer care is just a flight away. Learn more at sylvester.org.
When I first started going to Healthcare Pharmacy, it was because it was convenient. But over the years, I continued to shop there because I trusted them. One day I was picking up my prescription, and the pharmacist noticed an over-the-counter medication in my basket. She said, "I hope that's not yours. It will interact with your prescription." And I thought, wow, thank you. Trust is so important when it comes to your health. Healthcare Pharmacy, with 2 locations, Grand Harbor and Governor Square, where they care about my health.
This is For the Health of It with Tara Bush. Brought to you by the Health Services Authority. Caring people, quality service. Visit hsa.ky.
For the Health of It with Tara Bush.
Brought to you by Healthcare Pharmacy, where they care about your health. 2 locations, Governor Square and Grand Harbor. Refill and transfer prescriptions online. Call 947-8900 or visit healthcarepharmacy.ky. Also brought to you by Cayman Medical Center, Cayman's most awarded private medical clinic.
And UHealth, International University of Miami.
World-class healthcare in the heart of Miami.
The Light Room, your holistic sanctuary for physical and mental restoration, repair, and rejuvenation. The power that made the body heals the body. 38 Pasadora Place, Georgetown. Find us online at www.thelightroom.ky or call 938-HEAL.
For the Health of It with Tara Bush.
Yesterday,
Today,
always and forever.
Radio Cayman in the Cayman Islands.